Welcome to New Frontiers, the rationale for CDK4/6 inhibition in cancer. This is Lesson 2, the clinical rationale for CDK4/6 inhibitors with Dr. Cynthia Ma. Dr. Ma, what challenges with current therapy for advanced breast cancer might cyclin D kinase inhibitors overcome?
So the current challenges in the treatment of advanced breast cancer that the CDK4/6 inhibitors are trying to address is really endocrine resistance. The majority of the patients with advanced metastatic breast cancers are estrogen receptor positive or hormone receptor positive. Many patients do respond very well to this class of agents. However, many patients do not respond. Even in patients who initially respond, later on resistance develops, especially in patients with advanced disease. This has become invariably the case. CDK4/6 inhibitors is really trying to delay the development of endocrine resistance and also try to overcome resistance to these class of drugs.
What CDK4/6 inhibitors are being developed?
So currently there are three CDK4/6 inhibitors in clinical trials. The first one is the palbociclib, which received the FDA breakthrough drug designation last year. It's being evaluated for approval in patients with metastatic estrogen receptor positive breast cancer as first-line treatment. The other two drugs that are in clinical trials include the LEE-011 and also the abemaciclib. Both drugs are in phase 2 and 3 trials, especially in the metastatic estrogen receptor positive patients.
What appears to be the clinical benefit of CDK4/6 inhibitors in breast cancer?
The CDK4/6 inhibitors are developed with the aim to prevent or to delay endocrine resistance. Preclinical studies indicated there's synergy between CDK4/6 inhibitors and hormonal therapy agents. So in clinical trials, and these are early phase trials, with palbociclib, there has been improvement in progression-free survival in the first-line setting when combined with letrozole.
What is the potential impact of these inhibitors in ER-positive, HER2-negative breast cancer?
The potential impact, what we could see is, for example, in the early stage setting, the addition of CDK4/6 inhibitors could prevent or the treatment failure from aromatase inhibitor or other hormonal therapy agents. And in the metastatic setting, the use of CDK4/6 inhibitor could have the potential to delay or to prevent endocrine resistance so that patients can be avoided from chemotherapy longer.
What are the rationales behind various combinations with CDK4/6 inhibitors?
So there's preclinical evidence that combining CDK4/6 inhibitors with chemotherapy, which relies on cell cycle division, may be antagonistic. But with endocrine therapy, CDK4/6 inhibitor has shown to be synergistic and so may overcome resistance to these class of drugs.
How is blockade of the complex synergistic with the anti-estrogen therapy?
It's interesting that when the estrogen receptor positive breast cancer develops resistance, there's often a hyperactivation of the CDK4/6 activity. So therefore, the estrogen receptor positive breast cancers are particularly sensitive, especially when they become resistant. So targeting both the estrogen receptor and also the downstream cyclin D CDK4/6 pathway would be synergistic.
What are the most important things clinicians should remember about these inhibitors for cancer treatment?
Many cancers rely on CDK4/6 for cell proliferation, and inhibiting CDK4/6 can stop the cell division and there's evidence of synergistic interaction between inhibitors of CDK4/6 and hormonal therapy in estrogen receptor positive breast cancer.
Well, thank you for summarizing. This is important information for us.
Thank you.